Is there anything in the system that gives you a little difficulty, or that you once thought was one thing and then it turned out to be something else? Has the system thrown you any curveballs, or maybe left you a little less impressed in some categories? Do you see people with mobility issues come out of this quicker than people with stability issues? Do you see people with shoulder mobility take twice as long as people with hip mobility issues? Are you seeing any curveballs or anything that we could kick around? They're not isolated problems. Obviously, anytime we introduce a new system, we're going to have questions, we're going to have perplexing things, little head scratchers. Anything showing up?
I think one thing that's out there that I think anybody that is interested in using the screen to help them in their profession is to get very well versed on how to get the accurate numbers. The definition of how to set the athlete up, the few coaching points that there are. Obviously we don't want to do too much of that, but so that there can be consistency. Because I want to be able to call you and have a conversation with you, but we have to be speaking the same language. And if I'm scoring a deep squat or looking at things on a deep squat that aren't what you're looking at, then it's kind of pointless to do that. So I think that when we dive into this, if it's the first time you've started to use the screen, to get very good at understanding, how do I set the athlete up? What am I looking for? How do I score it? And then we'll start to connect the dots when we have those basic procedures, because they're non-negotiable. We don't argue those, right?
Yeah.
We have to do it the same way. There's no discussion on how we do the screen, how we interpret the score sheet, how do we prioritize what comes next in terms of correctives. And then after we've done those three things, that should get us those results repeatedly, over and over and over. Then we can be kind of creative with our corrective strategies. And I think that 4-step process of procedures, as far as setting an athlete up, to knowing how to score and interpret a score sheet, to assigning maybe the top 2 or 3 corrective strategies based on priority, and then give me a list of the 6 to 10 exercises that you're going to use for correctives, and to get that loop and just live in it. And that's something that I think, from a starting point, that a lot of people don't understand. This system is very it's very deep rooted, and it's I don't want to say complex, meaning confusing, because it's not, but you have to commit to what you're looking for so you can compare things from year to year and have discussions with other colleagues.
I think sometimes both you guys have great points about really learning the system, fundamentals first. I think we are, sometimes we go to a weekend seminar and we want to get rushed to do it Monday morning with our athletes, patients. And it's 4 o'clock, it's a long day. Oh man, and you're just trying to rush and you're not paying attention. And so I think it's important, as you two guys point out, to go back, take your time, read, do the fundamentals, place your athlete at the right position. That's the most important thing. That's the baseline of it all. And I think that gets, like anything, trainers, therapists that take weekend class, I think we are rushed sometimes. And if you take your time and really apply yourself, but Jeff brings a break up. You got to live it, because it's a way to discuss a patient, an athlete, somebody you really should care for tremendously. So it takes time. And Jeff's a tremendous teacher, just the amount of time he spends with us and we spend with him just discussing fundamentals.
Yeah,
that's the key.
Yeah, let me just try to cover the first 2 bits of that, and then I'll let Gray take over from there, because I'm just going to get blown away by what he's going to say. So we've actually dealt with this quite a bit as we've had kind of larger scale studies that have now happened, where you have to train 35 individuals and you have 2 days to do it, right? So how do you do it? And I think that when you go to a weekend course and you see the instructor up there going off, what's it, a 3, a 2, if it's Italian, do it. That's what I learned in Florence. Do it. Everyone's a 2-2, right? So it seems like that's how it should be done. But if you've only had 12 hours with the screen and you go in Monday morning, my recommendation is you take that book, you screen off that book, you have the score sheet there, But you follow the directions, and right now that's my primary, what we do in our research studies, you follow the script. It is a script, you follow it to a T. For now with the scoring criteria, we don't have the 3-2-1, we basically have the items for the 3-2-1. And based upon the items that are met, yes, you kept your heels down, you kept the bar behind your toes, the knees didn't deviate in the frontal plane. If they get all those, then they're a 3. So it literally makes a person kind of go through that checklist in their mind. Grace had that checklist for 11 years.
Yeah.
You know, as you become and utilize that screen, as you get close to that 10,000 repetitions of what you need, you begin to own it a bit more. But I really encourage for those people who are going out and use it on that Monday. First of all, don't use it on Monday. Take the time to develop what you're going to use, and then maybe go after it on Tuesday. Okay,
Yeah.
but really, don't think you have to own it to begin with. Go through, use a screen, use everything that's provided to you. Break out those. Don't use that one little scoring sheet. That's great to summarize, but use as much information you have to get it right. Because 2 years from now, you don't want to look at the back of that data and say, "I wonder if I did this.
Yeah.
I wonder if I." Well, if you followed the rules, you wouldn't wonder anymore. And that's what great when we're seeing post-operative patients or month 6 to month 9. I don't have to worry about, well, did he really have that? No, he had valgus collapse last time. That was marked.
Yeah.
So it really helps. Making it a little bit bigger than one sheet, I think, really helps improve your reliability and your understanding of what's going on. But all it is just kind of expanding the checklist that's already been provided to you.
And you have to see, and that's hard, because I'm not wired like these two guys.
Yeah.
You have to see in 3D.
That's right.
Moving.
Mhm.
It's not in a book.
That's right.
It's not stationary on a table.
So we'll get to rewind.
Yeah, that's right. So that takes a little time, but that's okay. That's okay. You can't get rushed or get frustrated. Keep learning fundamentals.
But that's the key, I think, to this, and you said the word is the rules.
Yes.
You have to know the rules on setup positions. You have to know the rules of what are the restrictions on deep squat and what do they look like at the 3-2-1 level. And that's what I meant earlier when it's non-negotiable. You have to live those rules. If you follow those rules and get to know those rules, don't put your subjective interpretation on them. You don't need to get to where you start questioning them. Stick to the rules. The rules will take you to the end result. And once you get there, then let your mind go crazy and challenge yourself to come up with a great corrective strategy for that particular individual. But understand there are rules, learn the rules, embrace the rules, because the rules are going to be your guide.
Yeah.
That's your life vest. Because we go back and
That's right.
we go back and have discussions as a team. It's like going back as a baseball player in spring training. You put the batting tee down and you hit some balls off the tee. Even if you hit 350 last year, that's where you start. So if we've been away from screening, if guys have been out of town and we come back, we'll review those rules, and that's part of our curriculum before the guys come back in. We'll take a week and just brush up on it. But the rules are the key.
And that's your best line. I've heard you say that. Remember the rules, procedures, rules. I mean that really takes you back to, oh, that's right. That's my focus. Foot placement.
But that's credibility with your patient or with your athlete when you can show them, here's where you were in 2008, here's 2009, here's where you were when you had the ACL, now you're back and you're better. Now just because you screened them in 08 and you screened them in 08 and I did them twice in 09 and you did them in 2010, all those numbers have to be reliable.
Yep.
And if you don't follow the rules, that's not going to happen. But that's how you develop credibility with a team or with that patient that keeps coming back and coming back. That's your signature.
Early in the screening stuff, I got to sit down and talk with a bunch of really brilliant individuals, and the very first thing that they articulated to me is, I wish we could put a sensor here and one here and one here and have somebody go through the screen. And I'm like, well, it's sort of the way that makes the warrior. Went right over their head. I was like, you don't understand. I'm trying to make you better here. The screen just is a simple tool. Using a hammer, being skilled with a knife, those are things that the user develops. And so what's going to happen at screen 200, at screen 800, is your eyes are going to start getting sharper and you're going to start seeing things. So I never envisioned you stepping into a phone booth and just going through video prompted movements and a machine spitting out a screen. It's a one body and mind appraising another body and mind so that they can make a unique situation to get that back where it needs to be. To talk about the weekend course, I see people sitting in the front row spin off into one of two different directions. They get so intimidated, they lock down, and they spend their free time discussing reasons why their schedule won't allow them to inject the screen. So they absolve themselves from the responsibility, or they go right for their worst train wreck, whether they're in rehab or fitness. They pick the person who got cut off in traffic, is going through a divorce, just went bankrupt, has a total hip, a fused spine, and that's who they screen. And basically you already knew the answer to that. They're not going to pass any of the tests, and the screen doesn't reveal anything because they're literally in pain or in emotional distress. They're a train wreck. So you stick a train wreck to the screen spits back out, hey, you got a train wreck. You didn't learn anything because you screened somebody inappropriate. I would basically start screening the people that you intuitively think would be perfect, and watch how many imperfections you find.
Yeah.
Secondly, as you mentor yourself in the screen, and let's say you start cleaning somebody up. I did this with the deep squat early in my career. Oh, it's all about the ankles. I got the ankles good. I measured the ankles were good, they still couldn't squat. Oh, it's T-spine. So I got the T-spine good. All the obvious motions that we see in our biomechanical mind's eye, I cleaned up. Shoulder flexion, T-spine, ankles. And then all of a sudden, I had somebody who seemed to be good on everything else, but they couldn't squat. And I went and looked at medial hip rotation. You don't see medial hip rotation in the deep squat test. However, since we make you hold your feet like this instead of this, we separate the people who have to squat like this from the people who choose to manage heavy loads like this. And if you don't have medial hip rotation and can't posteriorly rotate your pelvis at the top of your squat, you cannot squat with your feet parallel. So a lot of people are still scrutinizing to this day, I don't like the way they're setting up the squat, thinking that I'm going to put somebody in the squat rack for that lift. I'm not. There are so many subtle movement cues that are caught by sticking to those rules you talked about. There's 4 bullet points almost per each test. Sticking to those bullet points won't tell you where the issue is, but it'll tell you where it's not. And so you do 7 more tests, and where it's not reveals where it is. When people go into our corrective strategy, what they don't understand is I don't go from a positive, active, straight leg raise problem right into the corrective. The corrective is my opportunity to articulate to the individual what the screen captured, because most people who are going through a screen don't see the asymmetries and limitations that we see. If you've never squatted below parallel, it's normal to you. That perspective of taking your head that low and not going through your hips is normal to you, so you're not impressed by the screening process. When I take you, however, to the corrective that the screen kicked me to, you realize that I can do it on this side and I can't do it on this side, or I can't move my knee in front of my foot, or I can't do something. That's your aha moment. So when people are texting me and emailing me, how many sets and reps do I do on corrective? I'm like, what did the corrective show you? Because our first corrective offered for every movement screen is mobility. And if that doesn't catch you, I'm not saying you're just a stability problem, but I'm saying you're not a mobility problem. And then if the static stability drill or the low instability drill doesn't catch you, I'm not saying you're not a stability problem. I'm saying you're not a static stability problem or a mobility problem. I'm saying you're probably a patterning, coordination, or dynamic motor control problem. So what people don't understand is, because we only do the movement screen and don't have all these glorious breakout assessments like our medical exam does, they're missing the point. The corrective strategy is your opportunity to give the client, patient, post-rehab, athlete, whatever, a little bit cleaner perspective, to let them run up against the wall that you already know is there, embrace that, feel the restriction, realize that maybe breathing or foam rolling or one of these little simple things is going to help them right through it. Once we get on the other side, we can program on top of it. So don't discount the screen. It lines you up with a corrective strategy. It's always going to take mobility off the table first. If that catches you, own the fact that you've probably got a mobility issue. It's not saying you don't also have a stability issue, but I'm not going to let you go there until you clear the mobility, because freeing that joint or muscle, at least to a minimum level of competency, ensures me that this segment of the body is perceiving motion before it's expected to behave motion. So when they're going through these things, everything has its place. So when I tell people, the movement screen has some airbags built into it. Even if you're dumb, if you just follow the rules, you're going to wind up and land right on that $100 bill every time. Doesn't mean you shouldn't wear your seatbelt. So we got airbags, we still put on our seatbelt. Here's my point. Went through a 2-day workshop out of 4 days with a group that had hammered out about 12 screens per person. I brought somebody up. We screened them in a group. They're all walking around with their clipboards, trying to get their perspective and stuff like that. Okay, how many people gave this fellow an 18? Okay, a fifth of the hands go up. How many people gave him a 17? Another fifth of the hands go up. Before you know it, the guy's screens are scattered all over the place from 15 to 18. Understood, you've only got 12 reps under your belt, but let me show you something. And we've got this algorithm of which movement pattern, all movement patterns being bad, which one we take first. I said, how many people in this room are going to start with this guy's active straight leg raise as a corrective strategy? 100%. So what they think is, my goal was to get them all to say 17 in unison like a choir. It wasn't. It was to get them to his most limited factor or weakest link as quick as possible. So what that told me is, they were arguing, debating, and having a problem defining the difference in perfection and imperfection. But they were pretty freaking consistent finding dysfunction, which is the point of the screen. So, a lot of them wanted to take liability with reliability, and I said, hey, you got 12 reps under your belt. You're going to close that gap, but even when that gap isn't closed, the novice can see what we need them to see to take the next step. And I needed you to see the low-hanging fruit, the weakest link, because that takes you right into this little corrective strategy that first and foremost is a path of discovery. It is not a path of rehabilitation. You're supposed to learn from it, they're supposed to learn from it, so each of those corrective reps is literally a test the first time you do it. And what you see there is just as important as the screen number, because the screen number can evaporate now. You're on the path. Hit that corrective. If you ever need to know another screen number, don't look back at the page, rescreen, because it changes. It's a dynamic system. So,
no, that's a perfect. I think that's one of the most common errors isn't the right term, but assumptions that are made. That if I go from a 2-1 active straight leg raise to a pair of 2s, nothing else is going to change. I'm just going to hit that next corrective, which is great in robots. Doesn't work great in humans. So I think that, understanding that once you make something different and you own that pattern for the certain repetitions, you go back and you do that full screen, because it could drastically affect how that person's kind of organized their movement system.
Well, I think that's a great point, because I can kind of piggyback that a little bit. For the rules and understanding, again, what you're looking for in terms of dysfunction, I think that's critical, because I've had dozens and dozens of people that would basically just talk about the screen in terms of a score. Oh, he's a 12, and be done with it right there on the spot. But as we know, we could all be 12s up here and take 4 different courses of how we were going to correct our 12s. So it's not enough just to be able to come up with a score and put all your eggs into a score and say, that person's a 12, they've got a problem. That person's a 17, don't worry about it. Well, a 17 could still have some injury risk there that's very, very significant, and try to understand how to connect the dots of your 12 compared to my 12 so that we take the proper path. So it is more of understanding where those specific dysfunctions are, as opposed to just relying on a score, because a lot of people have seen the data you've talked about. If you are below a 14, then you are at a higher risk. So I've had professionals come to me and say, oh, well, we're just going to worry about the guys that are 13s and 12s. Okay, well, if we're all 14s and we're all 2s and we're all symmetrical, then what do you do from there? And a lot of people freeze then. They don't have that next layer of understanding how to direct that that score sheet, so.
One of the things sometimes I wish we had never done is given that end score.
Yeah.
Now, everybody likes to know 40-yard dash time, how much can you bench? Everybody loves that one number representation. And for all practical purposes, parents, coaches, general managers, and bosses, they get a total score, and we can articulate that very well. When I'm teaching a movement screen workshop, I got some standard lines I say every time. When in doubt, score low. Give them the best of 3. Our goal is 2s on everything, no asymmetries. But that is our goal for minimum movement competency. If you're trying to literally get an Olympic gold medal and you're satisfied with 2s on everything, no asymmetries, I'm going to tell you the transition from risk to removing any performance limitations in movement is what happens between a 2 and a 3. But if you're going for 3s, go back at the low-hanging fruit first. Get your mobility or stability. So, when I say 2s on everything, no asymmetries, that, believe it or not, is my way of absolving myself from a total score and saying, listen, 2 on everything, no asymmetries gets you a 14. That means if you get better than a 14, it's got to have no asymmetries in it, and you can't have a 1 anywhere in your score. So that's the way I try to talk, and these little semantic things that I say, if you follow those to a T, you will not make an error, you will not make an assumption. So I think that's awesome.